Hello friends, welcome back to Dr. Jackie's Academy. In today's video, I will discuss about the viral hepatitis C. If you remember in my previous videos, I discussed about hepatitis A, D, B and E. So in today's video, I will discuss about the viral hepatitis C. So let's start. So first of all, coming down to the viral hepatitis C's general point, it is very common in throughout the world, and it is known by the fact that it produces the chronic hepatitis. Another very important point is that if there is an acute hepatitis, it is very mild in nature or symptoms are absent. Another very important point is that even the chronic hepatitis is not clinically visible, clinically silent. So what I am saying is that the symptoms of acute hepatitis or the symptoms of chronic hepatitis are not very much visible. So what is the important thing? The important thing is that without much of the symptoms of acute hepatitis, without much of the symptoms of chronic hepatitis, person may convert into a very dangerous condition of a chronic renal failure. So coming down to the structural features of virus, it is small, enveloped, and it has RNA as the genetic material. So transmission, it is transmitted through blood or its products and infected needles. These are two major reasons or route of transmission. So very common in the drug abusers, but the incidences are very low due to sexual contact or from mother to fetus, perinatal. Lesser incidences because of these reasons, but very common because of these reasons. Now coming down to the pathogenesis. So hepatitis C virus, it is transmitted by injectable needles through the blood, and the virus enters inside the hepatocytes. So there is activation of the immune response, but see this word I have written weak. Immune system is activated, but it is weak in nature. So because it is weak in nature, the liver cells will not be destroyed and virus will not be eliminated. And ultimately, there is acute hepatitis, but it will be mild or asymptomatic because damage has not taken place. Chronic hepatitis will also be mild in nature. But as I told, this mild will ultimately progress slowly to the end stage. End stage liver disease will take place, that is cirrhosis. And apart from the liver cirrhosis or liver symptoms, there are extrahepatic symptoms. Other organs are also affected, like neuropathy, renal disease, or the lymphoma. So this is the pathogenesis in the figure form. I will discuss pathogenesis in the written form. It is characterized by the weak activation of the immune response. So virus enters to activate the immune response, but it is weak in nature. So in the absence of strong immune response, no major destruction of hepatocytes, no typical symptoms of hepatitis, and there is a clinically silent infection. Both acute as well as chronic are clinically silent. Slow progression of the disease because immune response is not activated. Viruses continue to remain inside the hepatocytes and viruses are not eliminated, and moreover these viruses change their shape, and this also allows them to escape from the immune response. And because of the continuous presence of the virus in the hepatocytes, chronic hepatitis slowly changes into the chronic liver failure. And the symptoms, about 70% of the patients develop chronic hepatitis, and the persons who are asymptomatic, when the symptoms were not developed, then the more chances of development of hepatitis C, chronic form. Then the development of chronic renal failure. The three different stages include acute hepatitis C, chronic hepatitis C, or extrahepatic symptoms. Acute hepatitis incubation period is about 50 days. Most of the time symptoms are not produced, patients are asymptomatic, and in very few patients mild symptoms are produced. Symptoms are same: fever, malaise, anorexia, mild jaundice. Chronic hepatitis, what is the meaning of chronic? As I discussed in previous videos also, if the virus is present in the body for more than 6 months, we say it is chronic in nature. Symptoms are not very prominent, they are very mild till there is a end stage liver disease, and the end stage liver disease is discussed in chronic hepatitis video. So what are the extrahepatic symptoms? Apart from the hepatic region, some other regions are also involved, like renal, neuropathy, that means damage to the neuron, damage to the nerves, lymphoma, cancer of the lymphatic system, Sjogren's syndrome. It is a autoimmune disorder. So this is what I wanted to discuss you about the hepatitis C. In the upcoming video, I will discuss you about with the jaundice, etiology, types, and the symptoms. Thank you.